the after the mouth, the nose, the pharynx, the larynx, and how they convert into trachea and esophagus, let us place the eye in the orbit. As you can see, orbit is quadrilateral. So it has got a superior wall, a lateral wall, a medial wall, and an inferior wall. And all of them are actually converging as you go posterior. So the superior wall, very simple, the frontal bone, this is the frontal bone, and this is the orbital plate of the frontal bone. So that is the superior wall. The important thing in the superior wall that you see are two foramen, the supraorbital and the supratrochlear foramen, through which emerge the supraorbital and supratrochlear nerves. Now they go and supply the scalp, and as there is air sinus in the frontal bone, that is called as the frontal air sinus, and it drains actually into the nose, and when that gets blocked, there is a sinusitis and there is a headache which radiates into the scalp. So that is what we understand about the superior wall. Now, the lateral wall. There is a bone with 3 arms, and that is the zygomatic. This one, this one, this one. It articulates with the frontal. So, frontal process of zygomatic and zygomatic process of frontal form a suture, which you can see. Then it articulates with the squamous temporal bone, this bone here. So zygomatic process of the squamous temporal bone. Thirdly, this bone articulates with the maxilla. This is the maxilla. So it articulates with the maxilla. And it has got an orbital surface. It has got an orbital surface, which is here. And on this orbital surface, you see a foramen which is called as zygomatico. If it comes towards this anterior side, it is zygomaticofacial. If it goes towards the temporal side, it is called as zygomaticotemporal. So, this is the zygomatic bone. But behind the zygomatic, you see this bone. Now, this bone is the greater wing of sphenoid. Let us say that let us sort of understand this rather well. Okay, now I have been able to place it quite well. So, supposing the scaphoid has a body, and this body actually houses the pituitary gland, and there is a sinus. It has got a lesser wing. As the lesser wing comes, it encloses a foramen which is called as the optic foramen. Now it has also got a greater wing. So greater wing has an infratemporal surface. It has got a temporal surface. But connecting the two is also a surface which is directed posteromedially. Now, that is this surface. So this is the greater wing of sphenoid articulating with the zygomatic, where you see which makes the lateral wall. Now this greater wing of sphenoid is very important because above it Between the greater wing and the lesser wing is the superior orbital fissure. And below this greater wing of sphenoid, between it and the zygomatic and maxilla, zygomatic and maxilla is the inferior orbital fissure. And as the lesser wing approaches, you see lesser wing is in the superior margin of the superior orbital fissure. As it approaches the body, it divides into two, enclosing a foramen, which is the optic foramen. So that's how these fissures are formed. Inferior wall, quite simple, maxilla and zygomatic. And let us now study the medial wall. So always in exam you will be asked the medial wall, because that contains many bones. So first nasal, second maxilla articulating with the frontal, third lacrimal having a portion which articulates with the ethmoid posteriorly, having a fossa which houses the lacrimal sac, and where there is a space for this lacrimal fossa to connect with the inferior concha of nose. That's the inferior concha of nose. Okay. So that's where that nasolacrimal duct will go. Then after this lacrimal bone, you will see a bone which is the ethmoid. Now this ethmoid we told you has a horizontal plate which is cribriform, has a crista galli above, and below it articulates with the nasal septum, and then it has two boxes hanging down on both sides. The orbital plate of the frontal bone overlies this cribriform plate, and on this side is the orbit, on this side is the nose. So the nasociliary nerve, having an anterior posterior ethmoidal nerve, passes through the cribriform plate, comes into the nose. So it is the lateral surface of this box that you are seeing here. It's the lateral surface of this box that you are seeing in this. And above you can see the two foramen between the orbital plate of the frontal bone and the ethmoid. You are probably able to see the anterior ethmoidal foramen, but there will be a posterior ethmoidal foramen also. Now behind this, behind the ethmoid, it is the body of sphenoid, in which the two roots of the lesser wing of sphenoid are coming into contact, enclosing a foramen which is called as the optic foramen. And between this greater wing of sphenoid and the lesser wing, you see the supraorbital fissure. Then between the greater wing of sphenoid and the inferior wall of the orbit, being formed by the maxilla and the zygomatic, you see the inferior orbital fissure. So after understanding this much, let us, in short, cover up the contents of the orbit. So there is a tendon which is called as annulus tendinosus, because it encloses the optic foramen and comes to get attached to the lateral margin of the supraorbital fissure. And you know that from the superior orbital fissure, the third, the fourth, the fifth A, that means ophthalmic, and the sixth nerves enter. Superior, inferior ophthalmic veins enter, and lacrimal branch of meningeal and meningeal branch of lacrimal artery also enter. So that's what enters through the superior orbital fissure, but this is the annulus tendinosus. And arising from this annulus tendinosus, you have a muscle on the superior side, the superior rectus, muscle on the inferior side, the inferior rectus, rectus means straight, the lateral rectus, and the medial rectus. So these muscles would pull the eye in their respective directions. But then there is another muscle which is called a superior oblique, which comes like this, winds round a pulley. There's a pulley, and this is the superior oblique muscle, and it will go around and get inserted into the eyeball. We'll show you how. And exactly opposite to it is the muscle which arises from this lacrimal fossa and goes and gets inserted into that other part of the eyeball. So we'll draw the eyeball and actually show you the insertion of these muscles. So we'll make this small. We'll actually draw the eyeball. And we'll insert these muscles here. The superior rectus, the inferior rectus. Let us say you are looking from the medial side, so the medial rectus. And then the superior oblique going up like this, winding round a pulley, and coming to get inserted on this part of the eyeball. The inferior rectus arising, the inferior oblique arising from the lacrimal fossa, coming like this and getting attached oblique to the opposite to the superior oblique. So this is the annulus tendinosus, and these are the muscles that move the eyeball, extrinsic muscles of the eyeball. And besides this, you have the fat, and then you have the eyelids, having a conjunctival sac in which lie the tears formed by the lacrimal gland. Then you have these beautiful eyelashes, and you have methods of closing the eyelid, orbicularis, oculi, and opening the eye, the levator palpebrae superioris. So you have this beautiful mechanism, and of course you have the third. The muscle supply is nerve supply is LR6, lateral rectus 6, SO4, superior oblique fourth, and the rest by 3. You have the third nerve, you have the fourth nerve, you have the fifth A nerve, which is the ophthalmic. Entering through the superior orbital fissure, it divides into lacrimal, frontal, and nasociliary. The nasociliary gets into the nose passing through the anterior and posterior ethmoidal foramen, then through the cribriform plate into the nose. So the anterior and posterior ethmoidal branches of the nasociliary. The second thing is that this frontal forms the supraorbital and the supratrochlear. The supratrochlear supplies the frontal sinus, and therefore pain or inflammation of the frontal sinus can be referred into the scalp and cause headache. If you want to find out how to recognize this headache, press on the frontal sinus, and if you have tenderness, it is because of frontal sinusitis. Of course, the patient will also complain of allergy and sneezing. Third, fourth, fifth, and sixth nerve, most important, coming in supplying the lateral rectus. And this we know is the weakling of the cranial cavity, and you test it by the doll eye movement. All right. So these are the third, fourth, sixth, fifth, and sixth nerves. The superior and inferior ophthalmic veins. So these are the veins. And the lacrimal branch of the meningeal and meningeal branch of the lacrimal artery. What enters through the inferior orbital fissure is the maxillary nerve. The maxillary nerve becomes the infraorbital and emerges in the face. Basically, it's a sensory nerve, but it is also carrying parasympathetic fibers from the pterygopalatine ganglion, which go into the zygomaticotemporal and the zygomaticofacial branch. And this zygomaticotemporal, as it emerges out, connects to the lacrimal branch of the ophthalmic and supplies the lacrimal gland here. So those are the nerves that are passing through the orbit.